Hello and welcome to our special show. Now, the COVID-19 pandemic has had positive and negative impacts on different aspects of lifestyle behaviors. Negative lifestyle behaviors are also associated with an increased risk of adverse outcomes from COVID-19. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted. Many people became more physically inactive. They developed irregular eating patterns, and that in turn led to unhealthier lifestyles and aggravation of lifestyle-related diseases. COVID-19 has also caused significant changes to our behaviors. We're working from home. There are more levels of stress. And therefore, a multi-sectoral approach to promoting healthier diets, increasing physical activity can all perhaps help us slow down the diabetic epidemic and the increase in heart diseases that we're seeing right now. Beat Diabetes, Myths and Facts will help a large number of people to prevent or control such metabolic disorders. And as always, we have with us experts to share their advice on just how you can lead a healthy life. We're joined today by Dr. K. Vamsi Krishna, MD, DM Endo, Chief Consultant Endocrinologist with the Seven Hills Hospital in Visakhapatnam. We also have with us Dr. Nitin Agarwal, MD, Internal Medicine, Consultant Physician with the Ayush Hospital in Bijapur. Dr. V.H. Kriplani, MD, Internal Medicine, Consultant Physician with the Kriplani Hospital in Kolhapur is also with us. Let me begin first with Dr. K. Vamsi Krishna. Dr. Krishna, there was a sudden surge in mucormycosis in people who also had COVID-19, especially those people who had very high, perhaps uncontrolled levels of blood sugar. Was this the only case, or are there other infections that people with diabetes should be extremely cautious about?
Yes, we are seeing a lot of mucormycosis in this post-COVID-19 era. Just like mucormycosis, there are a few infections which are almost exclusively seen in diabetic individuals, like malignant otitis externa, which is an infection of the ear caused by Pseudomonas. Then we have a special type of infections of urinary tract known as the emphysematous pyelonephritis or emphysematous cystitis. And then we have a type of gangrene in the genitals known as the Fournier's gangrene. Other than this, we have lots of infections in diabetes like urinary tract infection, genital candidal infection. Then we have the respiratory infections like tuberculosis. And then we see a lot of diabetic individuals present with us with skin infections, foot infections. The problem is the mortality and the morbidity of these infections is diabetic individuals is higher when compared to non-diabetics. And the death due to these infections in diabetes is an important cause of mortality in diabetic individuals.
Dr. Agarwal, this question is for you. People who've recovered from COVID-19 report higher blood sugar levels. Is it recommended that a patient who's been cured of COVID-19 should keep a check of his or her blood sugar regularly? What is the advice that you give to your patients?
Yeah, it is very important. It is very important to check the sugars more frequently for a patient who has just recovered from the COVID because of the various reasons. First is during the COVID, we usually escalate the drugs which the patient is on, maybe insulin or oral medicines. But that needs to be de-escalated or sometimes increased further. So one is that reason. Second one is use of steroids. The steroid use has been recommended during the COVID treatment. And even after the discharge, sometimes we give steroid treatment for short term. And during this period, the sugars are bound to increase due to steroids, and they need to be checked frequently. Also, the stress levels, as you said, in the COVID and post-COVID period, they are very high, and hence they also increase the sugar levels. So needs to be checked more frequently. Maybe a person who is on insulin, he has to check the sugar every day, and maybe a person who is on oral medicines, they can check the sugar less frequently, like every second or third day. That will reduce the opportunistic infections like fungal infections and also the cardiovascular diseases post-COVID, which are increased nowadays.
Right. Dr. Kriplani, we all know that our lifestyles have changed and perhaps changed significantly and for the foreseeable future, thanks to COVID-19. And because of that, stress levels have increased. All the risk factors that trigger hypertension have increased for virtually everyone. So my question to you is the risk of hypertension the same for men and women? Who is at greater risk?
In fact, during COVID-19 infection, there was an increased psychosocial economical stress. In patients who were chronically alcoholics, because of non-availability of alcoholics, there was increased suicidal tendencies. And once the alcohol was available, some people were at increased risk of consuming a lot of alcohol. There was non-availability of medicines, particularly antihypertensive, anti-diabetic or medications. There was issues with the OPT consultation, so also transport issues, and there was non-availability of hospital beds, particularly for the non-COVID patients. And therefore, overall, male patients were at increased risk of developing hypertension compared to female counterpart.
All right. So men, you feel, are more at risk in this case and therefore perhaps should be more careful as well. Dr. Vamsi Krishna, it's generally believed that, people who have perhaps, negative lifestyle behaviors could be more susceptible to diabetes and other chronic conditions. But there are people who are otherwise being careful, following a diet, exercising regularly, they can also have diabetes. Isn't that right? I mean, there might be genetic or hereditary factors involved for that. What are your thoughts on that?
The common types of diabetic individuals which we are seeing day in day out are type 2 diabetics. This type 2 diabetes is commonly seen in those individuals who have a poor lifestyle, who are obese, and irregular diet habits. But other than this type 2 diabetics, we also have other causes of diabetes like type 1 diabetes, which is autoimmune in nature. Then we have other genetic causes of diabetes like the MODIs. And then we have other drug-induced diabetes like when we get diabetes in steroids. And then we have other syndromes like Turner syndrome or Klinefelter syndrome, which these are all not related to lifestyle. So grossly, a good lifestyle can prevent the incidence and prevalence of type 2 diabetes, whereas these other causes of diabetics are not related to lifestyle.
So, Dr. Agarwal, clearly diet is of primary importance and, those with diabetes are always worried about whether they're eating the right thing or not. So, when you're on insulin, are there specific foods that you ought to also be having?
Yeah, the diet is very, very important in a diabetic patient, especially if a person is on insulin. We need to reduce insulin resistance, that is most important. And there are some facts like Indians, they consume a lot of carbohydrates. Almost 70% of our diet is carbohydrate. So we need to reduce the direct sugars and increase the complex carbohydrates in our diet. Like we can increase non-starchy vegetables, unprocessed food, increase the quantity of vegetables, pulses, and reduce refined food. That is very important. And you have to avoid trans fats or saturated fats, which again increases the insulin resistance and obesity. We also need to understand the timing of the insulin related to the food. The conventional insulins need to be taken at least 15 minutes prior to the meal time, and the newer insulins like recombinant insulin, we can take them just 5 minutes prior to, or if forgotten, just after the food. And taking frequent small meals in a patient who is on insulin is very important, rather than just 2 or 3 large meals. That will reduce the chances of hypoglycemia.
Right. We will take a very quick break at this point, but lots more questions for our medical experts on exercise, on blood pressure monitoring, and much, much more. We'll be back in just a moment. Welcome back to this special program. As always, we have medical experts with us telling us how we can lead a healthier and safer life. Dr. Kriplani, this question is for you. Now, during the pandemic, people resisted going to doctors or other health workers in order to get their blood pressures checked. Many actually even bought home monitoring devices. How accurate and reliable are these devices? Is there a correct way of measuring blood pressure at home?
There are a lot of issues, particularly home monitoring of blood pressure. First of all, we need to check the authenticity of the BP apparatus. If you have any doubt, you can counter check with mercury manometers. You can go for ambulatory BP monitoring, which will give the data about the BP at a home, BP in the office, and the BP when the patient is working. And it's important that you should differentiate between the mask hypertension and white coat hypertension. By and large, with white coat hypertension, most of the patients should be hypertensive during the clinical checkups, but in mask hypertension, it is the other way around, that these patients are hypertension at their home, and when you check the BP in the clinical setups, the BP is normal or near normal. So continuous BP ambulatory monitoring is a very much important aspect whenever you have doubt about the BP readings. And I think it's very much important you analyze the records of BP what the patient had come with to you, and then decide the authenticity of the readings.
Right. Now, it's been noticed, of course, that, the more people work from home or are in sort of confined spaces, they tend to eat out of boredom or eat more than they normally would, or perhaps even consume more tea and coffee than they would otherwise. And that can send sugar levels fluctuating. Dr. Vamsi Krishna, would you say that that's led to challenges in monitoring and managing diabetes? And what are your recommendations?
This is an appropriate question in this COVID-19 era. Work from home has become a norm for most of the individuals in the last 1 to 1.5 years. As a result of this, diet has been changed a lot. There is increased dietary intake, especially increasing the intake of carbohydrates, sugars. There is no proper exercise, adding to it the stress. So we are seeing a lot of individuals coming back to us with significant weight gain. Earlier they were having a good glucose control, but now they're presenting us with worsening of glucose control. So we need to educate them about the restriction of calories, especially the simple sugars, simple carbohydrates, which can lead to the worsening of blood glucose values. And along with this, they need to have a proper exercise, proper diet schedule, change their diet and decrease the stress values, and have a regular follow-up with the doctor to change the levels of medication.
Dr. Agarwal, what about exercise? Now, that obviously helps people with diabetes to control their blood sugar. But if a person is working out regularly, does that mean that they can then eat whatever they like or, not follow an appropriate diet?
No, diet is very, very important whether you exercise or you don't exercise. A diabetic patient should exercise for at least 150 minutes per week. That is a mandatory to maintain a good fitness level and to reduce the risk of cardiac diseases in diabetes patient. But 80% of the management in lifestyle is about the diet. So diet cannot be compromised even though a person exercises. So eating less of processed food and avoiding direct sugars is very, very important even if you exercise. And as I said, the complex carbohydrates and increasing the fat in the diet is very, very important. Exercise is at its place on reducing the risk factors, but diet cannot be compromised in diabetic patients.
Right. Dr. Kriplani, diabetes and hypertension are both independent risk factors for kidney damage. How serious would it be if both these factors are present simultaneously?
In fact, diabetes is a metabolic plus a vascular disease. It increases the blood sugar levels at one end and there is an impact both on a macrovascular and microvascular circulation. And if the patient is hypertensive, it adds to the injury. So the standard teaching is diabetes initiates vascular injury and hypertension perpetuates vascular injury. And if the patient who has diabetes alone, it's a bad for the kidney. If the patient who has hypertension plus diabetes, it's a worse situation. And if the patient has an additional risk factors like obesity, smoking, alcohol, analgesic abuse, and this is going to add to the kidney problems, and that is still worse a situation. By and large, diabetes, hypertension, coronary artery disease, fatty liver disease, osteoporosis, psychosocial stress, these are silent killers. And multiple risk factors are going to have impact on the vascular tree and kidney and heart in particular. So therefore, if the patient who is diabetes and hypertension is likely to have more kidney problems compared to those patients who are diabetes alone.
Right. Dr. Krishna, are complications of all types of diabetes the same, or can there be variations in the severity of these complications depending on the type of diabetes you have?
I already mentioned that not all diabetics is the same. There are various causes of diabetes. Roughly, we say it as type 1 diabetes and type 2 diabetes. Then we have the other cause of diabetes like pancreatic diabetes. Then we have the other genetic cause of diabetes. The reason being the complications are different in each of these individuals. For example, we see a lot of complication diabetes like neuropathy, nephropathy, retinopathy, which are very uncommon in type 1 individuals for at least 5 years of duration of diabetes. Whereas type 2 can have all these complications in the early part of diabetes. They can even have these heart problems right from the onset of diagnosis. Then we have some other genetic forms like MODY. Certain forms of MODYs are associated with increased risk of kidney problems. Then we have pancreatic diabetes, where the complications are similar to type 2 diabetes. So roughly we need to say, diagnose what is exactly the cause of diabetes so that we can guide the individuals how to have good glycemic control and prevent all these complications. And most important, a good sugar control is beneficial in preventing all of these complications.
Dr. Agarwal, a follow-up to you on that. What or which diabetes complications would you say are common in older people or senior citizens who have diabetes? And is there any specific advice that you can give them for managing these complications?
See, apart from the usual complications like diabetic nephropathy, that is kidney-related disorder, neuropathy, retinopathy, that is eye-related disorder, then the cardiovascular disorder and the peripheral vascular disorder. These are very common and also seen more commonly in the elderly. But there are many other complications which are neglected and common in elderly diabetics are frequent falls, incontinence of the urine, memory loss, that is dementia, depression, anxiety. These things should be more focused, and we need to ask them about these factors, because these complications make them dependent on some other person, and that will create more anxiety and depression in elderly patients.
Right. Dr. Kriplani, people with hypertension are sometimes a bit worried about doing exercise. There are fears that, after exercise, their blood pressure could actually sort of fluctuate, perhaps increase sharply. Is there any specific type of exercise that you would suggest for people with hypertension, and how much time should they spend exercising per day?
Yeah, patients who have a severe degree of hypertension, by and large, we advise them not to go for the strenuous exercises, particularly isometric exercises. And it's very much important. You require to have a cardiorespiratory assessment of these patients who have severe uncontrolled hypertension. Otherwise, simple walking, swimming is more than adequate for these patients who have a severe degree of hypertension. Otherwise, the patients who does not have any coronary artery disease, the hypertension is well under control, they are at liberty of continuing the exercise to their choice.
Right. All right. We'll leave it at that today. Thank you very much indeed for all your advice and expert comments. We hope this has been useful. Thanks for watching.